谢谢大家今天来参加我们的说明会。那么因为呢，我们这场说明会有 live 的，因为我们为了南部、中部的同学，所以呢，我们就用 live 的，也可以连接到我们中南部的同学来听我们这场说明会。假设呢，中间你们有什么问题，我们都把它放到最后的40分钟里头来问 Q&A， 因为这样的话，我们也可以开放给中南部的同学，好不好？那今天呢，我们也很高兴，请到了 Dr. Brian Toppett， 然后还有我们的 Instructor Miss Joyce Loman。Joyce Loman 她今天刚到，2点半刚到我们台湾，就直接来跟我们做这场说明会。当然，他们今天这一场的说明会最主要的目的是要告诉我们同学怎么准备 RN 的考试。第一个，这是最主要的目的。当然，第二个也要告诉在座的所有的同学，因为我相信你们都会听到网络上说，美国不缺护士，美国的护士已经不从外面再找外面的护士来。那么我们今天也听听 Joyce 来跟我们说，她到底缺不缺护士？那么我们假设一个外国护士要到美国做 RN。护士，我们该怎么准备自己到美国去工作？因为 Joyce 在这个领域里面，她不光是我们的老师，她也是我们的临床的老师，做了30年，所以她是非常有经验的。假设你们今天有什么问题，都欢迎问，因为这很难得，他们就只有来2天，所以呢，就礼拜天就回去了，所以非常的难得。Thank you for Brian and Joyce come over to Taiwan. This is our honor, and we're so pleasure you coming to here. I know both of you will introduce the N class, how to prepare N class, and then how to prepare to be registered nurse to work at the United States. So first of all, we just welcome Dr. Brian Toppett give us a lecture.
Thank you, Ming. Are we working okay? All right. Okay, first thing I'd like to tell you is we're glad to be here. It's our honor to be with all of you. And we're looking forward to it. And I have to say about Ming, she has just done an outstanding job of working with the course that we put together for all of you. We followed all the instructions that she wanted, and we put it together so we feel very comfortable that the course we have will work very well for you here and very well for anybody coming to the United States. It's well done. Thank you, Ming. Okay, now if I can work this clicker. Okay, why A&L Solutions and DLS? Why did we partner up? One of us from Taiwan, one of us from the United States. We had a lot in common. When Ming first met with us in the United States, said this is the perfect solution, let's work together. And so we spent a couple of years working together to make this class what it is, so that it could be used wherever you wanted to do your work. The platform that we built this on is an adaptive platform. The adaptive platform does a number of things. Okay? We've done a number of things. Can we turn that other screen up just a little bit? That's okay. That's okay. We're okay. All right. Great. We utilize simulations for one thing. We have a lot of simulations in the work we're doing where you can actually go online and practice and do the actual simulation itself, and Joyce will spend some time and give you some demos of those. We use videos, questions and answers, and we use content lectures. The class itself was built by a number of experts, and with the lead over here, Joyce, but we had a doctor that worked with us that's an outstanding doctor in the United States. We've got 4 or 5 other nurses that worked with us on the project, some that had just graduated, some that had more experience, so we could take the best of what everybody could bring together to make this a very good course. We have a test bank question and answer of 300. but we're building on that all the time, so it's going to have more in there. But we've got 300 right now that are ready to go. In fact, I think there's about 325 actually, because we keep adding to it. There's one thing that this course will allow when you're dealing with online. A lot of times you don't know how well you're doing. We have analytics that will keep you posted daily on how well you're doing. The other thing it does is it allows us, if people are missing a lot of the questions, we want to know why. And usually in that case, the instructor hasn't written the question right. We want to know that so we can fix it for you. We're recognized around the nation in the United States for our platform. The platform, Microsoft said it is the best adaptive platform anywhere in the world that we're using. And we have the proprietary rights to it. And then there's trust that we have, not only working with A&L, but the trust we have with other groups that we've worked with in the past. So we feel that's going to work extremely well. So one of the questions is, why does the United States need nurses? Don't you have a lot of schools? Why do we need nurses in the United States? Well, first off, over half the world does not have the number of nurses they need. There's a huge shortage of nurses. The World Health Organization, 48% of all the countries in the world need nurses. In the United States, nurses make up the largest segment of healthcare workforce. And our workforce is over 3 million nurses. Nursing is the fastest growing need in the United States. Of everything that we do, nursing has the greatest need. And the nursing demand outstrips the supply, and I'll give you some figures to show you what's happening there. But this has been built on decades. Ever since World War II, we've been short of nurses in the United States, and it's grown and grown and grown. According to our Bureau of Statistics, there will be 1.2 million nursing vacancies by 2022. That's a large number. By 2025, the shortage will be the greatest we have ever seen on a percentage basis. By 2030, the population of senior citizens will more than double. In the United States, 1 in 5 will be a senior citizen. In 2030, 69 million. By 2050, that grows to 88.5 million. 68% of our seniors have at least 2 diseases. We need more health care services as a result of that. Also, one of the things that happened in the last 25 years is we've been selling a lot of extended care insurance. That extended care insurance, we need many nurses, whether they be for the homes, because you buy the insurance, then you can have that delivered to you at home. So we need a lot of nurses to fill that gap. Our schools, most of our schools do not have the nurses. In the area that I live in, we have about 1 for every 7-8 schools. And the law requires us to have 1 in every school. We just don't have them. County health officials that work for the government, we don't have enough. 1 million of our registered nurses today are over 50 years of age. 700,000 nurses are projected to retire or leave the workforce by 2024. So you start combining those things, and there's a real need for nurses. Our largest group of nurses joined our nursing workforce before 1970, and they're still working today. And that retirement bulge is getting ready to come out through our system, and we're going to have a lot more help. Why has this happened? Doctors have more patients than ever before. So just the medical doctors, because a lot of our doctors operated in the, of course, in the hospitals, but they have their offices throughout the communities, and we have to have nurses to support them. People are living longer, more people over 65 than ever before. The other thing is an increase in outpatient services. So the type of care we're giving today is different than it was 10, 15 years ago. So there's a lot of outreach to the homes. Older nurses are retiring, and I mentioned the recession because in about 2008, when we were going through the recession, a lot of our nurses that were eligible for retirement said, I don't know what's going to happen, I may need more money. They stayed on. And those people were ready to retire at that time, so they're going out now. Colleges and universities can't keep up. We have a cap system in the United States. That cap system says for our universities, you can only have X number go through your schools. And they don't raise that number. But there are certain universities, a couple of which we're partners with, that do not have caps. They're allowed because they do so well with the nurse training that they have that the caps are off for them, so they can take more students. But there are not many of those universities. But part of our partnership allows us to provide schools that do not have the caps. The other thing that's happened in the United States is that women and men have so many more opportunities in the workforce. It used to be that a lot of the nurses went in, men and women, into education, or they went into the nursing, and now they're going into everything. They're entrepreneurs. They pick the areas they want. So we have a nursing shortage. And then the diminishing pipeline of new nurses. And I'll show you some of the numbers for that. There's future changes because a lot of our older nurses don't understand the improved technology that all of you know more about than they know about now because they're not used to it. And then, of course, the managed cares and the need for skilled and specialized nurses. So with the program that we have, we can take nurses that are already in the program, move them up to the next level. Some may want to go into a specialized field, which is great. Some may want to become teachers. We have the other problem we have is we don't have nurses available to do the teaching. So the colleges can't get nurses to teach more students. There's extreme need for skilled and specialized nurses. Opportunities, I've mentioned some of them, but hospitals, long-term care offices, facilities, medical offices, the schools, the counties, traveling nurses. Very few of our hospitals today can operate without traveling nurses because we just don't have enough. And of course the higher education, the teaching part of it. What about incentives? What do we pay? Higher salaries. The salaries start at $55,000 anywhere in the U.S. up to $101,000. And one state, it just happened in the last couple of weeks, they get a 20% increase in California, and they're at the $101,000, and these are the averages. There's salaries above it, but they just agreed in a contract for another 20%. The average across the United States is $78,000 for nurses. There are signing bonuses, and I verified this, signing bonuses for nurses coming in from other countries. There are signing bonuses for just signing up for the job and saying you agree I'm going to stay 2 or 3 years. There's housing support. Some of them are building housing support for all of their nurses that want to take advantage of that. There's transportation support, and there's education support. So if you get a job there and you want to go on and do a master's or a doctorate degree, they'll help you pay for that. In the final analysis, our calculations show that 2022 only 3,889,227,000 nurses. And in that group, it includes 457,413 new nurses from a combination of new nurses within our graduate program and foreign-educated nurses. After the retirements, we need, in addition to these 457,413, we need 690,048 nurses. So 700,000 nurses short. We need that many more than what we have right now with what they estimate coming through the system, 457,000. So we've got a huge shortage. So it's a huge opportunity for all of you in nursing. So how do we expand the program? How do we solve this problem? We expand the nursing programs, but universities, on average, take 25 years at least to build their program out. So that's not going to solve anything for the next 15, 25 years. We recruit nurses from other countries. Get good nurses from other countries. That's a huge priority. And it's a huge priority both of the government and all the local hospitals. Assist and train international students. We need to put some incentives in there to help international students come to the United States. And we need to offer that training. Some of the partnerships and some of the courses we're developing in joint with A&L. We've got the NCLEX course, it's built. We're going to build the IELTS online. We're going to put a conversational medical terminology online. And we're working with our university partners for residency requirements. In fact, one of the universities that we have a contract with, they have a big, huge hospital right across the street. So they do both the teaching, and then they get to go do the practice, and they get paid for that. The bachelor's degrees, master's degrees, and doctorates. All three are available, depending on what you would like to do. Visas, that's always a question. What are we going to do about those visas? The particular university that we're working with right now, they have a whole department. All they do is help you get your visas. And the type of visas, whether you come in on a student visa or work visa, and then if they've got residency, they can still pay you under the student visas. They can still do certain amounts of pay to bring you into the country as an incentive. So we'll work through all the different types of visas with you, but we'll do that through the university and their staff and A&L, because it's a team partnership. But know that we'll be there, because I know sometimes we worry a lot about the visa part. So that's my part. Now we'll give you some demonstration of what that course looks like, and Joyce will take that.
Good evening. Okay, good. I'm going to ask for a little bit of interaction here, okay? Because that's how this program goes. I don't want you to just be sitting there and I'm looking at blank faces. So as they said, my name is Joyce Lorman, and I have been working in the United States healthcare systems for the last 35 years. So from hospitals, nursing homes, home care, going into patients' homes, helping them after they've been discharged from the hospital, rehabilitation hospitals after someone has had a brain injury or a stroke. So I've worked in a variety of different healthcare settings in the U.S., so I can kind of help you a little bit about that. So I wanted to talk a little bit about working in the U.S. and why this is the A&L program is so important and why it's so different. I've been doing NCLEX training for the last about 15 years. I did a lot of work in Ireland. Ireland recruited 10,000 Filipino nurses about 10 years ago. And so I worked in Ireland, recruiting the nurses from Ireland back to the U.S. And we had a very good success. While I was there, there was a large group of Chinese nurses that were also living and working in Ireland. And so I also worked with them to come to the United States also. The expectations I want to start through for foreign nurses are the exact same as they would be for American nurses, except the one difference would be your English has got to be excellent. So if you're not immersing yourself in English, and that means talking amongst yourselves, your study classes, it's so easy to fall back on your native language, but that's not going to improve your English to come to the United States. And English is not English, as you all know. There's slang, and that gets brought into the work situation. So if you don't understand your coworkers, it's going to make it very difficult for you to do your job very well, okay? I'm going to be very direct with you about what it's like to work in the United States, so I just want to lay it all out there for you so it's no unrealistic expectations that they're going to say, come with open arms, no matter what level you are or how good or poor your English skills are. So I want to make sure we're clear. As Brian said, there's a variety of healthcare settings out there. That includes rural settings and city settings. I would say the majority of the foreign nurses are needed in the city settings, where your translation skills, even though we want your English to be perfect, you may be dealing with patients who are Taiwan or speaking your same language. So your ability to translate is just as important a skill that you bring to the table as well. So I want you to keep that in mind. The U.S. healthcare system is very fast-paced. You're working autonomously as an individual nurse, but you also need to work as a team member. So you need to understand all of the players on that team, whether it's an occupational therapist or a physical therapist or a speech therapist, the doctor, the hospitalist, palliative care. There's all kinds of team members now that you as a nurse really are the core with that patient. You're the core person. You're the one that's having the most interaction with that patient, and you need to be the advocate for that patient on a day-to-day basis. So that's important. If you don't ask a question, you will be held liable, and that means you can be sued. If you didn't know something and you don't ask it, you're sitting there and you're afraid, you're going to be held liable for that. So it's really important that you take responsibility. Some of the benefits for working in the U.S. as a nurse, as Brian talked about, money is clearly, it's one of the #1 paying jobs in the United States. The prestige of working in the United States. Once you've worked in the United States, you can pretty much go anywhere and get a job around the country, around the world. Whether it's on a base somewhere, a foreign base somewhere, or anywhere else if you want to travel around the world as a nurse. So that's important. New technology that you're going to be exposed to, depending on whether you're in a teaching hospital. There's new trials of drugs that are being used. There's new equipment that's being used. So the new technology is also one of the things you're going to have access to. In addition, the U.S. is a very diverse population. So what you may find in Asia is that you're very homogeneous. In the United States, we're very heterogeneous. It is someone from every single part of the world you're going to have exposure to. And that also brings different diseases that you may not be exposed to, that they have just because of their genetic background. So you're going to have exposure to different patients that you may not have exposure to if you were just here in your own country. And the bottom line is that we want to help you to successfully pass the NCLEX and be successful as working in a nurse in the United States or anywhere else for that matter. But passing the NCLEX, I think, also gives you prestige no matter whether you come to the United States or not. It shows that you have that level of knowledge and that expertise that would be expected in the United States. So let's go on. So the NCLEX exam, are you all, let me just ask, go back up. Has everyone finished their nursing program, or is everyone enrolled in a nursing program? Enrolled in a are you attending nursing programs now? Anyone? Are I'm assuming you guys are attending. Is everyone through? Anyone graduated? You graduated? Okay. So I just wanted to have a sense. Has anyone taken the NCLEX so far? No? Okay. So let me talk a little bit about the NCLEX just in preparation. If you have taken it, this will be redundant for you, but for those of you who haven't, I want to give you a little bit of information so that you're prepared. So what the NCLEX is trying to do is it's testing your minimum standards of practice. They test to make sure that you as an entry-level nurse have the minimum standards of practice and knowledge that you need to work in the United States. Every American nurse takes the exact same exam as every foreign educated nurse takes. So it's the same exam across the board. So going through that, then it's a minimum of 75 questions on the exam, and that's if you do really, really well and you pass with flying colors, or you have no ability to pass the exam, it will end at 75 questions. The maximum that you would take is 265 questions. That's the maximum. So if you do a minute and a half, 2 minutes in a question, that's a 6-hour exam. So I say that because it's important that you practice long periods of time doing NCLEX-like questions, not just 1 or 2 when you're on the train going to your class or going to work. That's not going to help your brain, which is a muscle, just like every other bicep muscle, that you need to lift in order to be repetitive, in order to build the strength. Just like the brain, you need to practice those NCLEX questions at long periods of time in order to pass that exam. Okay? Takes a lot if you're not used to sitting there and focusing and practicing the questions to be able to do it during the NCLEX. So that's important. So if you do 75 questions, 60 are going to count. 15 are practice questions that the NCSB is going to use in future exams. They want to see how the nurses are doing. If you answer 265 questions, 250 of those are going to count, and 15 again are going to be future questions for you. The average number of questions most nurses answer is between 115 and 118 questions. But expect and plan on taking 265 questions. If you're sitting there and it goes over 115, 118, just keep saying to yourself, I'm still in the race. Okay? I still have a chance. Because as long as it didn't shut down at 75 and you felt totally confident, you're still in the race. And each question is worth 1 point only. So if you don't know the answer to it, it's just 1 point. Okay? And those are important things to remember. Pearson VUE is the company that gives the exam, that gives you your ATT, your authorization to test. They are computer adaptive test taking. So does everyone know what computer adaptive testing is these days? So you answer a question. If you answer it correctly, it takes you to a more difficult question. If you don't answer it correctly, it gives you another question similar to see if you can get that type of question answered correctly. So every nurse is going to get a different test, different questions. It's all just random, and it's all based on your skill level and your proficiency. That's why sitting and doing those question banks of 300 or 500 questions is key for you getting your brain to understand and think NCLEX-like questions. And that's very different than the types of questions you would have taken in college, which is more rote answers. You know, where is this bone located, or where is this muscle? These are patient-centered questions. So the test-taking environment, you need to arrive about 30 minutes beforehand to get yourself relaxed. Don't cram before you go into the exam. It's not going to help at this point. It's too late. Just be relaxed. That's going to be the most important. Meditate. Do whatever it's going to take to have you be calm while you're taking the exam. Make sure that your name matches your authorization to test. Some people get married, their name changes on their ID, but their authorization they received beforehand or after. Those are critical little things that are going to make it so you don't have to go back and not be able to take the exam when you showed up and got yourself all excited to take the exam. They digitally fingerprint you, so when you go in, they make sure that you're the same person who goes out on breaks and the same person who comes back in after the breaks. And sometimes they do vein mapping as well on your hand. You cannot bring anything in. There's no watches, there's no phones, there's nothing. Everything you have will be on your computer if you need to do any notes or anything like that. So just know that you can bring some snacks in with you and leave them in your locker. So if you take a break, you can eat some fruit or a granola bar or something that's going to keep you up energy-wise. All right? Any questions about the NCLEX environment and what it's like? Sure. No, the calculators are included. You use it on your computer, so no calculators at all. Nothing. When I say nothing, I mean nothing. You bring your body and your brain, and that's it. No pens, pencils, watches, nothing, okay? They are very secure in wanting to make sure that the integrity of this exam is held to the highest standard, and that there's no way anyone could change persons when they go out on a break, or bring in any information that could defeat the integrity of this exam. Okay? So what are NCLEX-like questions? Anyone have an idea? What do you think NCLEX-like questions would be, or how would they be different? Someone must know. Yes. Yep. So it's patient-centered questions. So they give you a situation, they actually give you a patient. They give you the patient's diagnosis and then some of the assessments. And then it's centered around that patient and what would you do. So that's the difference of NCLEX-like questions versus questions that you might have completed in college when you were taking the program. Very, very different, but very practical for you functioning as a nurse in the hospital. Okay? So let's go through the NCLEX here. I want to go through and make sure. Are you all aware of the components of the NCLEX and what they mean? I need a yes or a no. Are you guys familiar with the components of the NCLEX? I'm going to go through just a couple of them. I won't go through the whole thing, but these are available online for you. But it is part of what we include in the A&L NCLEX preparation exam. So I want to go through it with you. Things like advanced directives. Anyone know what an advanced directive is? Anyone? Take a guess. What does advanced directives mean? What I want done in the future. So I'm giving some direction about what I want done in advance. So if I should become ill and not be able to communicate what my wishes are, I'm writing those down. I'm telling who I want to make my health care decisions. I'm saying I want extraordinary means to be given should I have a heart attack and be unconscious. I'm telling my family and my health care providers exactly what I want in the future. Okay? Those are important as a nurse to know because it's going to indicate what kind of care you give your patient. Maybe they come in and they're fine, and then they have a heart attack and they have lack of oxygen to the brain, and now they can't tell you what they want for care. But if they have a health care proxy and they have advanced directives, you'll know what they wanted. Okay? So those are kind of some of the things that we go over in the programming. Things like advocacy. As a nurse, you are the #1 primary advocate for that patient. So that is your job. Things like assignment, delegation, and supervision is critical as an RN. That is, I'm just trying to get over to the right spot. That is, I would say, one of the #1 parts of your job is managing who does what on that floor. What task would you give a certified nursing assistant versus a licensed practical nurse? You need to know what their scope of their job entails that they're allowed to do. Because if you give someone the wrong task and they're not licensed to do that task, you are held liable on your license. Okay? So I just want to run through safe and effective environment because it's one of the highest percentages covered on the NCLEX exam. 17 to 23% of the questions on the exam are under safe and effective care. Because there's nothing worse than not giving safe and effective care. You will have patients dying on you, and we don't want that, okay? So that's critical. Things like, confidentiality. That's another critical issue in the United States is confidentiality. Not telling anyone who's not directly involved in that patient's care anything. Not a family member if you don't have permission, not someone in the hallway just saying you wouldn't believe this interesting thing I've got going on with this patient. Nothing. You can be fired for that. I can't stress that enough, okay? Things like establishing priorities, ethical practice, informed consent. Making sure that no matter what treatment or procedure you give to a patient, you have informed them about the pros and cons of that treatment or that procedure and have them sign. Information technology, legal rights and responsibilities, performance improvement. When you're working in the U.S., you're going to hear those words every single day. How can we improve our performance? How can we decrease the number of falls that patients have in the hospitals? How can we improve the care that we give to cancer patients in their pain level? Those are all performance improvements. And what do we do for referrals as well? The other areas, some of the other areas I'm going to go through real quickly are safe and effective care. So safety and infection control. I'm sure here in Asia especially, you probably have a higher level of safety and infection control than we probably even do in the United States. I see people walking around with masks, you know, the hand washing, that has been drilled into you just in a more cultural perspective, even more so, I think. So I think that will be number one. But you need to know what procedure would you use in what situation. Okay, those are important. The use of restraints. In the United States, we are very clear about when and when not to use restraints and how to document that. If you don't have it documented why you needed to use those restraints, you can be held liable for that. You know, writing reports. Should a patient fall while you're there with them and you don't write an incident report and then later on they have a blood clot and they die from it, that's an extreme case, obviously, but those things happen, and that's why it's important that you fill those out. There are protocols that you need to be aware of and fulfill. So health promotion and maintenance, 6 to 12%. So the aging process, postpartum and newborn care, the development stages of growth, health promotion and disease prevention, health screenings, high-risk behaviors, lifestyle choices. You're going to run across patients in the United States that you never thought you would ever run across anywhere, just because of the homogeneousness and the diversity of the United States and the people who come to the United States from foreign countries. Techniques of physical assessment and self-care as well. Psychosocial integrity is 6 to 12%. This is relevant to, say you're working on a cardiovascular unit, and you may think, what do I need to know about psychosocial? Well, what if someone's being abused at home before they come in and that precipitated they're having a heart attack? You need to be able to document that you, in your intake with that patient, that you noted that they are fearful with the person that they live with at home. Or a child, if you're working in pediatrics and you notice bruises, you need to know that you did a good intake to understand why that child might feel that they're at risk. Chemical and other dependencies, huge in the United States right now. The opioid problem is just running rampant. People are being saved, but at the same time, they're, because of our healthcare system, going in and out of hospitals. You have someone who comes in and they have a back injury and now they want OxyContin, you know, and they're insisting on it. You need to know, is there another alternative? Are there some behavior management techniques that can be used? Are there you know, other techniques that you can be using? So that's important. Psychosocial. And let's go. So physiological integrity, assisted devices, elimination, mobility, non-pharmacological comfort interventions, nutrition and oral hygiene, hydration, personal hygiene, and rest and sleep just being important. Pharmacological, so blood and blood products, central venous access device, dosage calculations, that's 12 to 18%. Medication administration. Critical that you are asking for 2 forms of identification. You're checking the patient's bracelet, now you're asking them their name and date of birth. And if they can't answer, you need to have an alternative method. So those things are critical as well. Reduction of risk exposure, so diagnostic labs, laboratory values, potential for complications, and therapeutic procedures that you need to be aware of. I just want to quickly go through these because there's so much else I want to get at for you. Physiological adaptation, alternative to the body systems, fluid and electrolyte imbalances, unexpected responses to therapies that you may provide. You need to know what those are that you're going to anticipate. Medical emergencies. Okay, so let's get into introduction to test-taking strategies. This is not an NCLEX review course today, okay? This is to give you a tip of an iceberg of what is involved in the NCLEX review course so that you have a better understanding of what we are going to cover. So we do a lot throughout all of the questions is in test-taking strategies. Every single question we want you thinking these things. Remind yourself you know the material. You learned this. You are smart. You wouldn't be where you are if you weren't. You wouldn't have made it this far. And to stay calm while you're taking the exam and while you're answering the questions. As I said before, don't study the night before. Remember, the patient is always the center focus of every single question. So if the question's asking you, what would you do as a priority, and one of the answers is call the doctor first, and you're going to leave the patient and go call the doctor? Probably not, okay? So that's a dead giveaway of something you wouldn't do first. If they're asking you what's the first nursing intervention, the first thing a nurse would do. You may call the doctor later once you've got the patient stabilized, but that's not going to be the first thing you're going to do. Don't read too much into the question. All the information that you need is in that question. Don't start thinking, oh, they mismean this, or they didn't say this, or what about this? Because you're just going to create more drama in the question that you don't need to have, okay? Everything you need is in that question to answer. Practice, like I said to you earlier, the 75, minimum 75, and I would recommend even more than that at any one given time, okay? And questions are asking you to prioritize, delegate the care, and how do you communicate with the patient. Those are the core of what the NCLEX-like questions are asking you to do. How am I going to prioritize? What do I do first to save this patient and give them the best care? Who can I give this care to as a nurse? And then how am I communicating with the patient and the family and other team members? Okay, so those are the key things. Some of the other test-taking strategies. Read the question slowly. Don't skim the question and then run to the answers. Okay? Read the question 2 or 3 times if you have to slow your brain down. We all want to go really fast because we want to get to the answers to see if we can come up with what the right one would be. That's not the correct way to do the NCLEX exam. Read the questions slowly and thoroughly. Rephrase the question. What are they really asking me? Sometimes they'll say, a patient says this, and it's the wrong answer. Okay, you need to be able to rephrase the question. What are they asking me? Oh, the patient needs more teaching in this area because they're saying something incorrect. So those are key. Identifying the key words. First, what's the first thing the nurse needs to do? What's the priority of what the nurse needs to do? What's the best thing the nurse could do in this situation? And what's the most important thing that needs to be done? Things like the same word, odd words, opposite answers. If you've got 2 answers, increased blood pressure, decreased blood pressure, one of those is probably the answer. Those are little keys that we try to do along the way while you're doing this NCLEX course. So in the answers, you want to look at each answer before you make your choice. So again, just like you read the question real thoroughly, read the answers real thoroughly. Eliminate those answers that automatically you know are not the correct ones. And then you're typically down to 50-50. So now you're at a pretty good rate that you can answer that correctly. If one option is good but the next one is better, eliminate that first one. Okay? Sometimes they're trying to make sure that you're going to do the whole thorough procedure or technique. So if you think, oh, that's a little bit of what I need, but this one entails all of it, you want the whole answer. You want the best answer that is all-inclusive. Positive, it indicates that the patient understood. It indicates the best nursing action, that teaching would include, that the best assignment to give the CNA would be this. And negatives is what's contraindicated. A drug was given and it's contraindicated. The patient should avoid what foods when they go home if they've got diabetes. More teaching is needed when a patient says, you know, I can eat all I want when I'm on my insulin. Obviously more teaching is needed. And that the patient doesn't understand. Those are negatively worded questions. Answers that include never, none, always, only, they're exclusive. How can in healthcare, how can we ever have never is that going to happen? That only that one thing will ever happen. Those are kind of red flags that would say to you that that's too exclusive. It's excluding everything else that could possibly happen. So again, those are little keys to let you know about that. Again, some more test-taking strategies. You want to factor in where the patient is in the disease process or in surgery. Are they 1 hour, 1 day, or 1 week post-surgery? What you would do if someone was 1 hour after having a cardiac catheterization is different than if they were 1 day, right? So you got to factor in where is that patient in the disease process. What is the most important? I can't stress this enough. I hope that when you're taking the NCLEX exam, you're hearing me in your voice say, oh my good God, most important, best option, priority. Just the way I say it is the way you should be saying it when you're practicing the NCLEX exam. What's the best thing this nurse can do? What's the most important thing that needs to happen? What's the first thing that I should do? Say it just like that so that your brain actually really listens to you. If the answer option has multiple components like lab values and one of the components is incorrect, the whole answer is incorrect. You need to know your lab values, because usually they're going to give you 3 or 4 lab values in one answer, and you need to know if that one's skewed and it's off, the whole answer is wrong. Identify similarities in the answers. Eliminate those and pick the one answer that's different. You may find, let me give you an example of 3 different menu options or food, and a patient is on a particular diet, and 3 of them include the same types of food and one is a very different type of food. The one that's very different is probably the right answer. Okay, those are the little tricks to kind of remember as you're going through taking the NCLEX, and that's why we want you to practice this. Okay. The other thing that happens is the NCLEX is it's not just, multiple choice. There are a variety of different types of questions on the NCLEX. So there's alternative types. You've got your multiple choice, and that's the most common, but they can also do it with visual, with graphs, with diagrams, instead of with text. Okay? Multiple choice, they could give you 3 graphs, and you've got to pick the correct answer based on the graphs. They can also do what's called SATA, select all that apply. They're looking to try to help you to multitask at the same time. You need to know all the things that apply to that one patient situation. Ordered response. In a particular procedure, what would be the correct order to do, giving a patient a particular medication or giving them a particular procedure? What would be the correct order? Fill in the blank. That's usually calculations and numbers, and you're rounding up, so keep that in mind. Hot spots. Finding the correct anatomy. If they ask you to find where would you, do the pulse at the radial, and I'll give you an example later on. That would be hot spots. Chart and exhibits requires you to fill in the chart. Here's what the patient saw on their heart rate, on their EKG. Where would you chart that? And audio requires you to listen. Usually it's to breath sounds or heart rates. So they have phones that you need to listen to as well. So those are the different alternative types of questions that are found on the NCLEX also. So what are the NCLEX-like questions? We talked about it earlier. It's situational questions that are in a clinical setting, in a patient's home, in the hospital, a nursing home, but they're in a clinical setting. There's no cutting-edge technology that you're not used to, okay? So it's the NCLEX hospital that you're in. Everything's perfect, and you've got all the information that you need. It's based on your client's needs first. Families come after, but your client, your patient, is the number one. Don't need to surmise anything. Everything you need to know is in that question. Okay? Don't read into it too much. It's based on your typical practice. They're not going to ask you for these obscure, patients that you may see once in a lifetime. These are the types of questions you're going to see on a regular basis, the types of patients that you're going to see on a regular basis. They want you to focus on the patient, not just the lab values, so I can't stress that enough. It's patient-centered. And often ask you again, what's the best, first, most important, and priority nursing action? Those are the NCLEX-like questions. So we're going to go through a sample question. A patient reports allergic reaction to penicillin, and the MD orders cefaclor. What is the highest priority nursing action? I need a little interaction here, okay? So A is start the IV, B is identify the bracelet, the patient, C is verify the accuracy of the order, and D is monitor the bun. What would you think would be, we can just yell it out, A, B, C, or D? You think it's A, start an IV? Anybody else? You must have a thought. Okay, so if you know cefaclor and penicillin, 10% of patients are allergic to cefaclor if they have an allergy to penicillin. So that's something you want to know about your drugs and your meds. So what you'd want to do is verify the accuracy of the order. That would be the most important. God forbid you give a patient a drug that they're allergic to. Okay? So the highest priority there is to verify that accuracy of that order. All right? So in this image, the correct site of a radial pulse is where? A, under the axilla, B, C, or D? Right? We all know this, right? C? I hope we know this. We're in trouble if we don't know this. Okay? C, yes. Sample question. An infant is gagging on mucus and becomes cyanotic. What is the nursing priority? Call the healthcare provider, the doctor. What did I say earlier? Save the patient. Okay? Then call the doctor. B, aspirate the pharynx with a catheter. C, raise the infant's head and slap them on the back. Or D, give oxygen by positive pressure. What do we think the correct answer is? I need to hear what? B, aspirate the pharynx with a catheter. Yay! Okay? Raising the infant's head, wrong way. We're putting the head up. We should be putting the head down, right? Giving oxygen by positive pressure, we don't want to push that mucus plug into the lungs, right? We want to be aspirating and pulling it out. Okay? Good. So another sample question. A patient has some questions about breastfeeding. What is the best nursing action? Give the patient written information and tell her you'll review it with her in the morning. Tell the patient you'll call the lactation specialist to meet with her. Listen to the patient's questions to identify her concerns, fears, and issues, or offer a video for her to review. C, yes, okay? You don't want to be pushing her off and telling her we'll talk about it in the morning. She obviously is concerned. You don't want to tell her you're going to call the lactation specialist because they're going to be mad at you that you're pushing it off on them. And you don't want to offer a video. How do you know what video to give her if you don't know what her concerns and issues are? Right? So a lot of this is common sense, just understanding if you were that person, how would you want someone to work and treat with you? Good. So what do you need to know? Obviously, lab values, you need to know. CBC, your ChemStat, your renal functions, electrolytes, lipid profiles, your INR. You ought to have those numbers down like nothing else. That's rote memory. No one's going to help you with that. You need to know the normal vital signs for an infant, child, and adult. So what's the normal heart rate, respiration, blood pressure, body temperature? Okay? What you need to know, calculations. Everybody's laughing. Yes, calculations, okay? You're going to have a couple of those. It's probably somewhere between 5 and 10 questions you're going to need to know. So you all know how to do some of these basic conversions. What your desired dose, dose on hand, how you're giving it, and what the amount is to give. In addition to medications, you need to know the therapeutic drug levels. What you need to know before you give a high blood pressure med. What do we need to know? What their blood pressure is, right? If we're giving them something to lower their blood pressure and it's low already, would we give it to them? No. Save the patient, okay? I want you to remember to save the patient. Typical drugs for high blood pressure, diabetes, anxiety, seizure, heart disease. You need to just know what the typical drugs are. You're not going to be able to ever know every single drug out there. But you need to know the most commonly used medications. And most of the meds on the exam are going to be listed as a generic form because in Canada they're listed as different names, and now we're all trying to use just the generic name. So keep that in mind as well. Okay, what else do you need to know? What task, as I said before, that you can delegate. This is critical because you as the RN are the highest level on the unit sometimes. So you need to know what tasks you can delegate. What the proper communication technique is, always focusing on the patient. Clinical anatomy, where to observe, palpate, osculate, where to get that information from, okay? And when more teaching is needed, based on what the patient and family has told you or shown you what their level of understanding is. If I'm going home, I can do this, or I can't do this. I should exercise four times a week at 3 hours at a time. Well, that might be a red flag that there's an issue if someone's just had surgery. right? So you need to be talking to the patient to find out what their level of understanding is. Positioning, you need to know the names of the positions and when are they used. When do you use a semi-fowler? When do you use a high fowler, right? You guys know all those for different procedures. EKG components, what's the PQRST, QRS complex XST? You need to know where they are on the strip, all right? General, you need to know HIPAA. I can't stress this enough. Are you guys all familiar with HIPAA? Yes, no? Okay, no. So HIPAA is the Health Information Portability Accountability Act of 1996. This is, you're going to hear that word, I can't even tell you how many times in the United States. It's HIPAA, 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 HIPAA. It is all about confidentiality, not sharing information, even if it's the patient's, you know, elderly mother. You cannot share that information unless they have given you permission to do that. You can't send a document to another doctor unless the patient has signed to approve that you can do that. Okay? So it's really critical that you get yourself familiar with HIPAA. We went over proper identification. Again, you cannot give a medication. You can barely pull up a bed sheet if you don't ask a patient what their name and date of birth is. Okay? So get that drilled into your head too. Maslow's hierarchy, physiological versus psychosocial. ABCs, what are ABCs? Airway, breathing, circulation. Okay, save the patient. Who can delegate what task? We went over that. Okay, this is the core of the NCLEX questions. Are they asking me to assess the patient further? Are they asking me to do analysis based on the vital signs and the blood work I have in front of me? Are they asking me to make a plan for what treatment am I going to do? Are they asking me to implement the treatment, or are they asking me to evaluate what I've already done? That's the core of every NCLEX question. So you can ask yourself, what are they asking me? Do more assessment? Evaluate? Implement? Reevaluate? What are they asking me to do? Okay? So keep that in mind as well. And we go over that in the NCLEX training program. Sample questions with the SATA. What's the correct procedures for following standard precautions? Select all that apply. Wear a face shield when entering the room. Avoid contact if the nurse has an exudated lesion. Place the patient in a private room with negative air pressure. Discard used needles in the trash. Wear gloves when in contact with bodily fluids. So what are all that apply for standard precautions? Is wearing a face shield when you're entering every single patient's room, is that a standard precaution? No. So we can eliminate that, right? Avoid contact if the nurse has a leaking lesion? Yeah. Place a patient in a private room with negative air pressure, is that standard precaution? No, that's not standard. Discard used needles in the trash? No. They need to go in their proper receptacles. Wear gloves when in contact with bodily fluids? Yes. Okay? So that's the way you go through it. Is that true? Is that false? Is it true? Is it false? When you're doing select all that apply. Oops. Sorry. Yep. Okay, here's another one. Arrange the following interventions from the first thing that you would do to the last when treating a patient with external bleeding. So this is a drop and drag, okay? So you'd click on it. I can't in this particular case, but this is how some of the questions are on the exam that we do in the program. You click on it and you drag it over to step 1. So what out of these 4 things would be step 1? Administer an IV fluid, apply direct pressure, dress the wound with a pressure dressing, or elevate the extremity. What's number 1? What is it? Apply direct pressure. Stop that bleeding, right? Stop the bleeding. What's number 2? Dress the wound with a pressure. How about elevate the extremity to stop the blood from flowing, and then you can elevate it on a pillow, you can elevate it on a number of, or just by your hand. When treating a patient with external bleeding, dress the wound with a pressure dressing, and then administer IV fluids. Okay? So that's a drop and drag type of question that we want you to get used to when you're doing this. Types of questions with hot spots, the point and click. So you might point and click at the location of the chest where you would locate the point of maximal impulse for a patient who has congestive heart failure for 6 months. Okay? So that's going to be different than a patient who just was diagnosed with congestive heart failure because of why? The heart has stretched. Okay? After 6 months versus just been diagnosed, the heart has stretched. So where you're going to hear that point of maximal impulse is going to be a little bit different. You need to know some of that. Point and click on the torso, the location of the 11th central nerve, what the 11th central nerve locates. Right? So they're going to give you a torso, and you need to put shoulders. Okay? Point and click on the location of an infant diagram where you would administer immunizations. Would that be in the shoulder? Would that be in the thigh? Thigh. Okay? So those are the kinds of questions that they're going to ask you. Types of questions for fill in the blank. How much fluid intake did your patient have during this shift? This is going to be a given one. You're probably going to do it 400 million times in your lifetime. 3 ounces of apple juice. So how many milliliters in an ounce? 30. So you've got 3 ounces times 30 equals 90 milliliters, right? A half a grapefruit. Is this fluid? Right? It's food. Not a fluid. Fluid is fluid only. Okay? 1 cup of broth. How many ounces in 1 cup? 8. How many milliliters in an ounce? We just went over that, 30. So 30 times 8 equals 240 milliliters. And then 350 cc's of 0.45 of sodium chloride. So what's the total number that we've got? Add it up here for me, folks. 90 plus 240 plus 350. 680. Okay? So that would be a fill in the blank that they would ask you to do. All right? Okay. Approaching for the questions. Want to go over it again with you. Look at the question first. Read it slowly, thoroughly, at least twice. Read and find the stem. What are they asking me? Pick out the important hints. What's the time, the age, the vital signs, the setting, and the lab values of that patient? Write on the whiteboard that you have on your computer. You can write out whatever you need to do. You need to start prioritizing things or doing the calculations. You have a little whiteboard on your computer. Put the question in your own words if you have to, and start doing that when you're practicing the NCLEX questions. Eliminate any absolutely wrong answers. Get them out of the way. Get them out of your brain's thinking, and then move on so you can do maybe a 50-50. Evaluate what answers are left. Is this a true statement? Is this a false statement? Is this a yes or a no? Make it really simple for yourself. Take an educated guess, and again, remember it's only worth how many points? 1 point. And that will help you stay calm when you know it's only worth 1 point. So some of the examples of our NCLEX prep course are things like we go over the lesson with you, we do a question with feedback, so if you pick the wrong answer, we give you feedback as to why that's not correct. We do some videos, and then, is everyone clear on what a simulation is? Right? We run through a procedure. We run through giving a person an injection. So there's simulations in there. There's also videos if you need to see what's happening in the heart. And I'm going to show you a few of those in just a second. Okay, so an example of a lesson would be meningitis is an infection of the central nervous system. You can click on to see the assessments, and then you can click on to see the interventions. Bacterial infection of the cerebral spinal fluid is described as what? The fluid is cloudy, you've got increased white blood cells, elevated protein, and decreased glucose. Okay, so it goes through the lesson for you. Then when you click on the assessments, this is what you'd find in the patient. They've got headaches, they've got chills, poor feeding, lack of appetite, rigidity, high-pitched cry, altered loss of consciousness, level of consciousness, bulging anterior frontals in an infant. So these are all the assessments that you'd find with someone with meningitis. And then here are the interventions of what you do. You want to maintain isolation precautions. respiratory isolation for at least 24 hours, assess their neurostatus, monitor for seizures, monitor I&O. So it'll go through the whole thing for you, okay? So then let's go through. A nurse knows which of the following indicate a bacterial meningitis infection for a cerebral spinal fluid. Select all that apply. So we just went over this. This should be easy. Decreased glucose, decreased protein, transparent cerebral spinal fluid, increased white blood cells. So let's say we pick the wrong answer and we say decreased protein. This is what will pop up. Sorry, this is incorrect. Identify characteristics that indicate bacterial infection in cerebral spinal fluid. Remember what normal cerebral spinal fluid characteristics are. So then the next one you pick again, you would pick decreased glucose and increased white blood cells. That's correct. Okay, so you get some feedback automatically when you've picked your answers. Okay.
These are called septic.
What questions do you have? Anybody have any questions about the program or about the NCLEX in general? I answered everything perfectly. Someone must have one question. No? Any thoughts? All right, well, thank you very much.
Know that that's a sample that you see out of the entire course. Those are just some samples of the whole. So when you take the entire course, you're going to be well prepared for this end class. And I said there was a bank of questions. There is that bank of questions, but all the way through here are the examples and questions also.
Right.
You've got two different sets of questions that you can work off of as you're going through it. So you get to the end and you want to say, okay, now I want to check, see what I've learned. You can go into that database of questions.
So by the time you finish the program, you've probably answered 500 questions, because we've got questions, filtered throughout the whole program, so that you get a little bit of practice on questions that are specific to that module that you're working on at that particular time. Okay, sure. No, absolutely not. Absolutely, for the Philippines, for everywhere. It may be a program that I may utilize in the United States, actually, at a community college that's having some trouble with nurses passing the NCLEX exam. Yes, right now. The questions, well, we try not to have them broad. I mean, we're hitting all of the areas that are going to be covered on the NCLEX. But again, you're going to be answering about 100 questions throughout the program as you do the modules. And then at the end, there's 300 practice questions. So we would hope that you would do as many as you can get access to. We're still developing more NCLEX questions, so we're hoping at some point it'll be up to 500 NCLEX-like questions. But the more questions you answer, the more likelihood that your brain is just in that way of thinking and answering questions. So, 75 is not going to be enough for you to know how to answer the NCLEX questions. And the sooner that you get your ATT and take the exam, the more likely you are you're going to pass. We find that people who take their exam within 30 to 60 days after they get their ATT, the better their likelihood of passing, because they make themselves sit down and test. They make themselves practice the exam. The longer you drag it out, the more time you have, you make excuses.
I think one of the other things that's critical too is to know that when you're taking that, working on your English skills, that we also, at the universities we're partnering with, they have labs that will help you too. So it's important, as Joyce has said, you need that, but there's also labs that you can come in and work, and they're going to work with you too on that particular component. In fact, one of the universities we're using has a large percentage of foreign nurses, and they work together on making sure those English skills are up. You can pass questions? Maybe you may know of other questions too that people may have that this group may not have asked. Questions you have.
Yeah, one question. Most of our nurses, before they check the NCLEX, they will fill the application form. Some of the agencies, they told them they should have the NCLEX or TOEFL test. Is that true? So they should apply the NCLEX first, right? And then later on they discuss the languages.
Yeah, most companies, I had my own recruitment company as well when I was working in Ireland, and you know, it doesn't do them any good to bring you on board until you have your NCLEX. They can't apply for any immigration until you have your NCLEX and then your IELTS. There's nothing anyone can do for you. So that's why it's critical. You become more of a commodity the more you've got under your belt. So if you've got your NCLEX and your IELTS, then you're very well sought out. You're somebody they want.
And they will work with you. You have to have that NCLEX. They can take a 6-month period, bring you in, they have time to get your IELTS filled up. But you have to take it within a certain amount of time. So that's, when you come in without it, you're going to concentrate on making sure you do get that English. Or if you come in with it, you can start right into the program itself. But there's multiple ways that you can do it. We can get that figured out for you.
Yep.
Does it have to be IELTS, or we could just say for the English proficiency?
The one, depends on the university. The universities we're using will take both. Either one. Either one.
The only conflicting factor about that is certain nursing boards will only take the IELTS. They won't take TOEFL. So you need to know what state you're thinking about working in and what do they accept. Will they, you know, and obviously you can't get your visa screen, you can't go through CGF&S unless you've done your NCLEX and your IELTS. So you need all of that before you can even get your visa screen. So that's why it's really important to get started on all of this. The sooner the better. To get all this under your belt. Your NCLEX will last forever. Your IELTS and TOEFL has an expiration on it. So that's why it's important to do, I think, the NCLEX first and then do the IELTS TOEFL. Well, thank you for your time.